Welcome to Generations, a show which helps people 50 and better lead happy, healthy, and productive lives. Hosted by Nadia Giordana. And here's Nadia.
Hello, you're watching Generations. I'm Nadia Giordana. Co-hosting with me today is Diane Winkler.
Very nice to see everybody and enjoy listening to all this good information.
Nice to have you here, Diane.
Thank you very much.
And Stephen Dodds.
Hello again. What's on the menu today?
Well, we have two exciting guests today. First up is Deborah Delaney.
Hi.
And Deb is an expert on caring for the elderly. And you are the CEO of Touching Lives Adult Day Services. Is that correct?
Yes.
Can you tell us a little bit about the services and how they fit into the community?
Sure. Touching Lives Adult Day Services supports 18 and above, as defined as adults, that need additional care, aren't able to stay home alone. They may have traumatic brain injuries, Alzheimer's, dementia, and our goal is to keep people in their home and community as long as possible. We also provide in-home care, so we kind of blend the two together because it's not healthy to stay home all the time, and especially if you're alone. And then yet somebody can't come into the house typically for 8 to 9 hours a day. So we try to blend the two to get people out in the community and also socialize. And they have many, many friends, so.
So people can they bring their loved ones, did you say that? Can they bring their loved one into the facility, or do you have people that go out? Are both services available?
Both are available. We provide transportation as well as there's local transportation like with SmartLink, and there's also then families bring their loved ones to the center. And we open at 7:30 and we close at 6, so it's right during the working hours. So a lot of services will be 9 to 2, but who works 9 to 2 anymore? So, and then Saturday we're open 10 to 4 upon request.
My goodness. Everything is available.
Yes, it is.
You've covered it all.
And it's a wonderful, I've come to realize over the past 12 years when I got into this that aging is one of the most disrespected journeys in life, and we're out to change that. I come from corporate and technology, and this is the fastest growing industry for the next 40 years. And so how do we support this aging journey with dignity? I mean, these are people, people every day. And we keep them happy, we keep them safe, and we keep them free of pain, and that's our goal to do.
Well, one thing I've noticed very much about what you do is I'm in the Winter Carnival and I'm in the parades. And the last 6 or 7 years, we have had so many seniors on the side when we're going on our way and we're waving to them. And I just say, I thank you for coming. Because there's something that never, ever happened prior to that.
Well, by 2020, in Minnesota alone, we will have more aging population than school-age children for the next 30 years. So you're going to see more and more of those people on their sideline.
That's wonderful. We like that.
Yeah, and and it's wonderful. I mean, to age is a privilege, is what we always tell people. And everyone that comes into the center receives a band that says, aging is a privilege, respect the journey. And I think we as a population need to understand that the aging is our population starts aging the minute they're born. It isn't a stigma that's to mean that you're old. And I think a lot of us do that, and it's not. I mean, it's when you are born, the minute you're 1 day old, you start aging. And I think that there's just this negative stigma with the aging, and it's unfortunate because people fear aging. And
So where do you think this negative stigma comes from? I think you started to answer it right there.
yeah, it comes from many different areas. First of all, I think and truly believe a lack of education, what it is to be a privilege, and how it is a privilege to age. But also, when you have individuals that require care, and all of a sudden people will say, well, I never in a million years expected at a 40-year-old adult child be taking care of my mom or dad and have to change Depends. I mean, it becomes a burden to people, and so that's a negative stigma to them. Whereas aging, if we looked at it from a respectful position, we all age differently. I age different than all three of you. I have my own traditions, my own values and preferences, and if we focus more on that and what we provide people, then I think that will change.
Are there any differences which vary according to culture?
Absolutely, and the tagline for Touching Lives is quality care with cultural comfort. We're very diverse in our care. If someone has to pray at noon before their medication, we let them pray at noon, and they go home at night. Every culture is different with their aging. You know, in America, we're different because most of our elders or our parents or things will find a home for them, or we'll put them in assisted living. Whereas other cultures, that's their primary goal, is to take care of their aging parents. And we don't see that. And yet as the boomers age, they want to live a quality life, but they also want to provide quality care for their loved ones who need extended care. So we always talk about, when I talk with families, is that there's all kinds of home and community-based services out there before looking at placing someone in a long-term care facility, and exhaust those options first. There's a service for anything that you need, you know, and there may be a time where they have to go into a care facility, and it's sad. It's a hard decision to make.
So how do you persuade people that it's okay to come and ask for help like this?
Well, first of all, you nailed it. It's okay to ask for help, and especially in Minnesota, where we think we can do everything.
That's right.
But it's okay to ask for help. What I try to share with families, and Nadia and I have talked about this before, is that there's two roles that a person has, and one of them is a caregiver, and the other one could be the spouse or the adult child. So to give you an example, is if somebody was coming to our center, Touching Lives, and they wake up in the morning, and a lot of them are just like kids, and says, you know, honey, I have a tummy ache. The wife would say, okay, you can stay home. Whereas the caregiver says, no, you need to go. By the way, they have a nurse there. They can check you out. So once you're in that position, whether it's your aging journey, whatever journey you're on, the first thing I tell families, you have to own it. You have to own this journey. You know, it's sad. These diseases are nasty diseases, and it's sad to watch a loved one go through that, but you have to own that journey. And once you decide to own the journey, then you can start asking for help and resources that are out there for you.
I think sometimes the problem is that the changes happen so fast. I remember a few years ago, I was nursing a gentleman who had an ALS kind of disease. And when I first met him, he was mobile, he was able to do a lot for himself. And then in a very short time, he was bedridden and eventually died.
And that truly depends on the disease, too. Early onset for any type of dementia, the younger you are, the faster it progresses. And so your life can change in a nanosecond. I can walk out here, go out to the car, trip, hit my head on a bumper, and next thing you know, I've got a traumatic brain injury. So planning, you know, own your journey as you age. Do you have those resources in place? Do you have the insurance plans? Do you have some type of estate planning? And, you know, don't wait until it's a crisis. And we all do that. And it's very easy to do that because we're all wrapped up in our lives and we're very, very busy. But own the journey. Once you start to age, you have to own that journey.
You know, when you think about adult day services, which to me is so different from nursing homes and nursing care and things like that, the idea of either having someone come into your home or sending someone out to the person who needs care. You're down in Savage, I think, is where, are there more facilities like that? Are they prevalent or are they not so much?
Yes, there are. There's a great organization called MADSA, it's Minnesota Adult Day Service Association, that lists some of the adult days, not everybody, but if you go to the Department of Human Services and you go into adult day licensing. Every licensed facility throughout the Twin Cities in Minnesota is listed.
They have something like that, or
yes.
at least access to it.
Absolutely. Yeah,
Do all these organizations provide the same level of care, or is it some that are very specific?
No, we're all different to some. There's adult day services is typically defined in two categories: a medical model, a social model, or a medical social model. Touching Lives is a true medical model where we do chronic care as well. So we have people with trachs, tubal feeding. We have individuals, we do Hoyer lifting. A lot of adult days, I'll get referrals from other adult days because they don't take that level of care. It's not right or wrong, it's just that they're more of a social environment. But that's kind of it's always a touchy subject because for me, it's hard to say to somebody today that you can no longer come to the adult day because your care is just, your acute level of care needs more. So it's hard for me when you're typically in a social environment and you just happen to, progress a little bit in your disease that all of a sudden they can't take care of you. That's very traumatic. So we try to keep them as long as possible. It can be, these individuals are scared. They're afraid they're going to be placed in a long-term care facility.
What about in smaller towns, in outlying communities? Is there as much available there?
No, that's actually, rural health is a real a challenge topic. Our goal is to expand that through, I consult now on helping people put in or build adult day centers as well as patient-centered residential medical homes so we can get more people. Instead of me putting a Touching Lives out there, how can I help someone it's in a rural environment, especially for our veterans as well. We do a lot with our veterans, and rural health is a real hot topic. There's a lot in the Twin Cities area, but the need is out in those neighborhoods.
It's the tiny little towns that are 30 minutes away from
and
a supermarket, for example.
And you're challenged leaving your loved one at home because you're afraid they're going to get wandered off somewhere, in which they can. Because they're so confused. And so, rural health is a major concern for a lot of home-based community services.
So what kind of financial support do you tap people into? Is there any way you can help them, say, get a grant for a wheelchair ramp, for example?
Yes, there's many resources out there. First of all, there's waiver programs through the government, disability programs that if you qualify, mainly it's income-based, they will pay for attendance, transportation, bathing, foot care, all of that. There's also like the Parkinson's Association, they will give you a grant for those services, like they'll give up to $500 to help the family. So we put families in touch with a lot of resources to try and see if they can get some funding. There's nonprofit organizations that help with home community-based services as well. But those are typically more for income dependent. And of course, then there's private pay, long-term care insurance, and that they pay that as well.
That's a big help.
Oh, it is. It's an expense. And what's tough is to try and help families realize it's okay to spend their retirement because they keep saying, I'm going to save it for a rainy day. And then, the rainy day to them is going to a nursing home. Whereas here we try to say, it's okay because we're keeping you out of nursing homes to use your, what your savings has been or your retirement towards keeping you in your home. So, it's an education process.
Yeah, that is the rainy day. And we're running out of time. Deborah, thank you for being here.
Absolutely.
Stephen, you too.
Thank you.
And Diane.
Yes, thank you so much.
It was great. Thank you for having me.
Oh, it was great having you here. And don't go away because we have another guest coming right up.